Alright, so we're going to talk about antenatal betamethasone for women at risk for late preterm delivery. My name is Nicole Macias. Alright, so infants who are born 34 to 36 weeks of gestation, so let's say late preterm, are at great risk for adverse respiratory and other outcomes that those who are born at 37 weeks of gestation or later. So it is not known yet whether betamethasone administered to women at risk for late preterm delivery decreases the risk of neonatal morbidities. So we have methods. We conduct a multi-center randomized trial involving women with a singleton pregnancy at 34 weeks and 0 days to 36 weeks, 5 days of gestation, who were at high risk for delivery during the late preterm period up to 36 weeks and 6 days. So the participants were assigned to receive 2 injections of betamethasone or matching placebo 24 hours apart. The primary outcome was a neonatal composite of treatment in the first 72 hours. The use of continuous positive airway pressure or high flow nasal cannula for at least 2 hours, supplemental oxygen with a fraction of inspired oxygen of at least 0.30 for at least 4 hours, extracorporeal membrane oxygenation or mechanical ventilation, or stillbirth or neonatal death within 72 hours after delivery. So here's the video of someone explaining more about the antenatal. So the results. The primary outcome occurred that in 165 of 1,427 infants, let's say 11% in the beta-metoxona group, and the 200 of 1,400, let's say 14.4% in the placebo group. Severe respiratory complications, transient tachypnea of the newborn, surfactant use, and bronchopulmonary dysplasia also occurred significantly less frequently in the beta-metoxona group. So there were no significant between group differences in the incidence of pteriamniotis or neonatal sepsis. The neonatal hypoglycemia was more common in the beta-metoxona group than in the placebo group. Here's another video. Now, the conclusion. Administration of beta-metoxona to women at risk for late preterm delivery significantly reduced the rate of neonatal respiratory complications.